more of a philosophy rather than anything else. Safety first. And for that, you also know when you are taking a flight, watch your step. And again, as a laparoscopic surgeon, please watch your instruments. And the outline would be, know thy instruments well. First was know thy anatomy well. Second was know thy limits well. And third is know your instruments well. Please, and make sure that if you are using, you are not barbecuing the tissues. If you are using the foot pedal, I will just summarize in few words so that we do not get delayed for the flight. So in few words, for example, if you are using a foot pedal, please make sure that you, at least I am very much tuned to using the hand switch of the harmonic rather than the foot pedal, because I have seen, I cannot show that video now, that there was a surgeon who was doing TAPP and he had left the hook inside. Sister's foot fell onto the foot switch of the monopolar cautery, and after few one click, one step, and it was right external iliac vein gone. What I mean to say, so make sure that you tackle your instruments very well. You do not leave the instruments inside. You do not believe on foot pedals. You believe on hand switches, so that anything and everything is under your control as well as under the control of your team. And there is no role of sorry. I always tell, sorry ka role sirf ghar mein hai. Ghar mein jaake so many times you can say sorry, but not in the operation theatre. Failure is not an option. Failure is not an option. That is our thought. And again, as once we are using the energy sources, please make sure that whether you are doing monopolar, bipolar or harmonic, it should be minimum possible. It should be judicious possible. When we are doing hernias, especially in concern with TAPP and TEP and ventral hernias, please make sure that we are using the sterilization to the hilt. In the sense that all instruments, all scopes are autoclavable today. Please do not blame that my system does not allow that it should be autoclavable. No, they are autoclavable, and buy those instruments which are autoclavable. Don't buy those instruments which are not autoclavable. One. Second, ETO. Definitely we have got in our Bhatia Global Hospital, we have autoclave and ETOs. But in Gangaram Hospital, we have the Sterard also. So thinking is, ultimately, you cannot generalize that you will do only one hernia a day. You cannot. You have to do 5, 7, 10 hernias a day. So if you have to do 10, 7 hernias, you should have different kits, one, and you should have an excellent backup of sterilization equipment, and one. Second thing is that when we are taking care of the mesh, treat it as an implant. Treat it as if it is a cardiac implant. Treat it as if it is a orthopedic implant. So handle with care. I think in all the meshes they should be written, handle with care. So ultimately, if the sister is going to take the mesh from the technician, she should not keep it onto the patients. She should not keep it on the towel. The mesh should definitely be taken by the surgeon. Any cutting has to be done by the surgeon. Any suturing has to be done, it should be done by the surgeon, so that ultimately it is not carrying the commensal staph aureus from outside into the peritoneal cavity, into the extraperitoneal space. Then similarly, when we are putting in a mesh also, when we should make sure that the trocar has been angled with so much of ease that it is not going through the peritoneum. So again and again, instruments have to be taken care of. Mesh has to be taken care. Please do not use the tackers again and again. I know, and we know in India we can have, every criminal has his own justifications. They will say that my patients cannot afford, but believe me, patients can afford if you tell them that this is the sterility, which is very, very important, and if you have had infected mesh, you had it. And my name will also go all around the country. So aim is that please do not reuse, do not re-sterilize those, and then ultimately you will be able to make a difference. Similarly, when you are using the monopolar cautery, monopolar hook, make sure that the outer black covering of the instruments is intact. I have seen many surgeons using the instrument again and again and again and again, and then ultimately the insulation goes off and it touches the intestines and ultimately presents with the complications. So our thinking is, tackle your instruments well, believe on sterilization. The most dangerous phrase in the language is, we have always done this way. Please do not follow the seniors who have always been saying that I have been doing basin repair and it has no recurrence. I have been doing Lichtenstein repair, it has no recurrence, but all of us know how many recurrences come to us or any other surgeons. So our thinking is that we should strongly believe on this publication in Annals of Surgery in January 2020. Should zero harm be our goal? Yes, we should always aim for that we do not cause any harm to the patient. And there is a difference between quality versus safety. Safety is the avoidance of a negative outcome, and quality is the achievement of a positive outcome. So if you make sure that your quality as well as safety are intermingling or working hand in hand, then only you will be able to make a difference. And again, I am not going to delay that, but I just want to make sure this slide, this Jacobius had told in 1910 that it is the puncture itself that causes risk, and in 2022 still we strongly believe it is the puncture itself that causes risk. So at the time of putting in the Virus needle, please do not get distracted. Do not switch on your mobile phones. Do not talk to your family members. Please pray, because the Virus needle insertion or the first entry or the Hassan entry, that can be dangerous. And believe me, in God we trust, all others must bring data. And the data says, at the moment, this is the global burden of post-operative deaths, and still we are the third greatest contributors. Believe me, it shakes us that even if we do so much of surgeries, but still we have not been able to conquer that. Still the post-operative contributor is 7.7% after the ischemic heart disease and stroke in the global burden of deaths. So our thinking is, please believe on this aspect. Distractions lead to disasters. This is a match being played or the sleeve gastrectomy being done. So one should be very, very cautious. Our mind is not here, our mind is here. So please do not attend to the mobile calls. Please leave the mobiles outside. Distractions lead to disasters. Thank you very much. God bless you all.